Dr. Marwa Abd-Elaziz, PhD in Medical Surgical Nursing and a lecturer of Faculty of Nursing. I'm honored to speak to you through this video. I'd like to talk about through this video is about how to care for yourself if you are COVID-19 positive patient. First of all, don't be panic. Don't be panic at all. Don't be anxious. Consider it as a respiratory tract infection and begin to deal with the disease and begin to care of yourself until healing occur. Don't be panic. Always remember yourself that 90%, nearly 90% of patients recovered. Okay, we know anxiety increases cortisol level, which decreases immunity. So it worsens the condition. Anxiety worsens the condition. So please be optimistic. Always think positive. Always think hopefully that it will be a period of time of respiratory tract infection and will be healed. Please think like that all the time. Okay, so be calm, don't be anxious, and begin to care of yourself. Okay, I'd like to speak about if you are in the quarantine, if you are inpatient in the hospital, and if you are treated at home. Okay, let's begin if you are in the hospital. To be in the hospital is very good because they offer a lot of facilities which is not present at home or be hard to be present at home. The hospital will offer the complete isolation, the infection control measures, so it is good to be at the hospital. They will offer the proper nutrition also and the medication. So it's good to be treated at hospital. Okay, so if you are in the hospital, what you have to do as a caring of yourself? They will offer uh, medication, they will offer nutrition, they will offer good infection control. It's okay, very good. But what you have to do, please, any respiratory tract infection, what we have to do, first of all, to clean the airway frequently. Frequently cleaning the airway, nose, mouth, and pharynx. Especially in COVID-19, we use gargling by water and salt, or frequently use lemon juice in the pharynx because these substances kills any bacterial or microbes or viruses in this area, especially the pharynx. Okay, so first this area should be cleaned frequently. Sorry, it's okay. Then, if you have secretions in the trachea, in the respiratory tract, if you have sputum, sputum is the waste product of the battle between white blood cells and viruses and microbes, resulting in waste products, pieces of white blood cells, pieces of bacteria, pieces of viruses. All of this uh, com- compose at the last the sputum or the pus or the exudate, which is considered the waste product, so it has to be cleaned frequently. You have to expel any sputum in your chest frequently. Frequently. It's very important. How? Frequent hot drinks. Frequent hot drinks. Frequent back percussion. If you are in the hospital, nurses will do that. Even if they do, you can do it for do it. It's hard to do it to yourself. You can help each others, your colleague or your neighbor patient can do it for you, and vice versa. What's percussion? Percussion is using my hand like this by this shape, and percuss on the back from the bottom to top, from bottom to top. Why we do that? We do that because this percussion can help to expel sputum from downward to upward, so it be easily to be expelled out the respiratory tract. So even if nurses do it, you can exceed the times by do it to your neighbor patient, and also other patient can do it for you. This is if you are in the hospital. um, Another thing uh, which is very important, uh, coughing technique. Coughing technique. You have to cough deeply to expel the sputum. Sputum cannot be exceeded by superficial cough, like this. You have to cough deeply from the trachea like this. This is the deep cough which expels the sputum. But the superficial cough like this, this is this cough doesn't expel the sputum. So you have to drink uh, hot fluids, to gargling by water and soup, and lemon juice, and this percussion technique. Okay, so now you are cleaning your respiratory tract frequently, so you expel any waste product, any bacteria, any viruses frequently. So you are exceeding, you are hasten the process of healing. Okay, and again, be trust of healing. Trust of healing. Think positively. Think hopefully. You will heal, and you will be recovered, and you will regain to your normal life. Okay, just help yourself. Okay, this is the first part if you are in the hospital. Okay, the second part, if you are at home. If you are at home, you have to perform complete isolation procedures. How? It's not very hard. It's not very hard. Just the you and the homemate will need to use to it. How? First of all, you have to be in a separate room. This room has to be good ventilated. The room air should be changed frequently, and sun rays enters this room. It's very important that sun rays enters this room. Okay, and you are yourself expose yourself to sun rays directly every day from 8 from 10 a.m. to 12 m.m. It's safe to expose yourself to sun rays. Sun rays, we know it's very helpful and very beneficial to kill bacteria and viruses. Okay, this is the characteristics of the room. Okay, how you can isolate yourself from homemade? At the door of this room, outside the door and inside the door from your side, from inside the room at your side. There is what? There is a small table which carry face masks and disposable gloves. This table is 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 present outside your door, directly outside your room door, and another one the same like it present inside the room, also directly near the door. For what? Anyone from your homemate enters your room should wear face mask and disposable gloves, then enters your room, and they have to keep 2 meters space between them and you. Okay, do whatever they wanted to do. They wanted to speak to you, they want to tell you something, they want to offer you the meal, whatever. They have to keep 2 meters between them and you. Then they finished, they go outside the room, close the door, remove face mask and remove gloves. Put them in a basket uh, beside the table which has the face masks. Okay, this is how they act when they enter your room. If you are go outside this room, you you have the same table from your side. Inside your room, you have the same table which has face masks and disposable gloves. You're gonna wear the face mask, the disposable gloves, and go outside the room. Do whatever you want to go to the toilet, go to the kitchen, whatever. Uh, please, please, uh, if you went to the toilet, remove the gloves, wash your hands carefully, and wear another gloves from the table outside your room. Then go to the kitchen, do whatever you want, and return back to your room. Remove mask and gloves. Okay, your your meal, your meal, your meal. You have to wash the dishes carefully, or the one who cares for you have wear gloves and wash your dish and sponsors carefully, and please keep a private dish and teaspoonful for you through the period of treatment. Okay, it's simple. This isolation procedures is are simple, and you're gonna use to it. Okay. Um, Regarding caring of yourself, as we said, what you have to do in the hospital, the same you have to do in the home. Frequently clean this area by water and salt and lemon juice for pharynx. Frequently expel sputum. by coughing technique we agreed in the beginning of the video. Okay? The person who cares for you can do this percussion technique for you, so help you to expel sputum. Another thing you may to do to facilitate expelling of sputum, which is smell evaporation from water. Water vapor, you can smell it, which is loosen the sputum and can so you can expel it from your chest. And in the first and the last, don't be panic, don't be anxious, be optimistic. Think hopefully you will be recovered. Thank you very much.